Dental implants have changed the face of dentistry over the last 25 years. Here to discuss these advancements is Dr. Anil Punjabi of Redlands Community Hospital.
With the aging population, especially in the United States, there are over 68 million people with missing teeth. And out of that, about 25% are completely edentulous. And edentulous means they have no teeth at all. With the baby boomers aging, nobody wants to wear dentures. And dental implants have a very important function to play in that. Dental implant is a replacement of the root of a missing tooth. A dental implant is a metal screw which is inserted into the bone. In order for this to be successful, you need to have bone. We usually prepare the bed with either bone grafts or other means to make it acceptable for the implant. So the implant is a metal screw which is screwed into the bone. It is allowed to integrate with the bone, and that is known as osseointegration. Once it has integrated with the bone, the implant is then loaded, and when we load it, we actually place the teeth for which these implants were made in the bone. One of the prerequisites of placing an implant is having enough bone, and many times in the maxillary or the upper back area where the maxillary sinus is located, we may not have enough bone, and in that case we have to do a bone graft by elevating the sinus and placing the bone graft in the sinus to provide bone for placement of an implant. Most of the times though, because of the bite and because of the desire to protect the healing period for the implant, we usually place the implant, allow it to osseointegrate or integrate with the bone for about 3 to 4 months, then expose it and then place the crown on it. So there is a process that allows the implant to be placed, allows it to integrate, and then reconstructed with a restoration like a crown or a bridge on it. So sometimes it can be done in a day. If the bite is favorable, sometimes it may take 4 to 6 months before you actually have the teeth in your mouth.
Dr. Punjabi talks about the history of implants.
Dental implants have been around for a long time, but scientifically proven with strong clinical research to back their use has been since the 60s. It was an orthopedic surgeon by the name of Brennemark from Sweden, who was an orthopedic surgeon who first started using these titanium screws in the tibia. His dentist friend said, why don't we try it in the jaws? And that's how the implant was born. And from the 60s, these implants have been used extensively, have been researched extensively, have a very great track record. Success rates are way up high in the 90s, and function is phenomenal. The best advice for anybody who has many missing teeth is to have them replaced, because not only is it detrimental for the remaining teeth, which have to bear the load of those missing teeth also, but as we mentioned earlier, the bone loss that goes with missing teeth causes even further deterioration in a person's bite. With less number of teeth, chewing and swallowing becomes difficult. Sometimes speech is affected, and some people do have gastrointestinal problems with improperly functioning teeth.